right, let's go ahead and get started. Welcome, everyone. Good afternoon, good morning to those of you on the West Coast. It's really great to have so many people joining us for today's conversation about reframing the government's role in health. This is the third event in our Health Justice Framing Forum series, where we get together every couple months to share real-time insights from our research here at Frameworks and framing guidance for communications challenges facing the movement for health equity. My name's Corinne Whedon. I'm the Senior Director of Communications here at the Frameworks Institute, and I am going to quickly walk through how we're going to share this space today before we get started with the presentation. So first, the number one FAQ, today's webinar is being recorded and will be shared with everyone who registered, along with the slides and the resources that are shared during the webinar. So you'll get those via email, and they'll also be available on our website. If you have an AI note taker, please go ahead and disable that. In terms of communicating with us and with each other during the event, if you have a question you'd like to submit for the presenters to answer, please put that in the Q&A box. If you put it in the chat, we don't always see them, so please put all your questions in the Q&A box. We'll pause twice throughout this conversation for a Q&A period, and we'll get to as many of those questions as we can. And although we have a big group today, we really do want this to feel like a discussion, so please feel free to use the chat to interact with each other. You can react to the presentation, share your own thoughts in real time. You can also use the reaction feature at the bottom of your screen, as I've seen some of you have already done. Thank you. The hearts and thumbs up help us know we are making sense, and if we're not, that's where the Q&A box comes in. Okay, let's meet our speakers for today. Nico Connolly is a principal strategist on the health justice team at the Frameworks Institute. Since joining Frameworks in 2022, he's led reframing and narrative change workshops for nonprofit and government leaders, offering strategic communications guidance to practitioners, advocates, and policymakers nationwide. Katy Evans is Senior Director of the Health Justice Program at the Frameworks Institute. She sets strategic direction for the program and manages Frameworks research, application, and communication to strengthen the field through advancement of policy and systems change. Along with her team, Katy identifies and shifts cultural mindsets that impede efforts to advance a vision of health equity. Through this work, the Health Justice Program equips movement builders and social change organizations with the tools they need to communicate more effectively about the issues that matter. So with that, I'll hand it over to Katy to get us started.
Thanks, Corinne. It's lovely to see so many of you, particularly in the middle of the summer, which I know is a challenging time for folks to join these. I'm really excited to be here today and to be working with Nico on this. We're going to spend today sharing some new research and recommendations, as Corinne said, about the intersection of government and health. So as we've been out in the field working with lots of folks in public health or advocating for Medicaid or in other places that experience this intersection, we've been hearing a lot about the challenges of navigating mindsets about government, contending with the real harm government has done at times in communities, and advocating for the ways that representative and democratic government institutions are necessary to scale the interventions that will lead to health equity. This is a challenge we can't address without powerful evidence-based communication. So it's a question we've been taking up on the health justice team at Frameworks, and we're excited to share some early research with you. So for those of you who are unfamiliar, the Health Justice Program at Frameworks is designed to advance a vision of a country where all systems that support health and well-being serve all people and advance justice. And we do that in three ways in community with all of you. So the first is creating new and ongoing research to better understand the mindsets that block or accelerate progress towards health justice. We're going to talk about some of that today. We also work on framing and narrative strategies that can help dismantle systems of oppression and enable system and policy changes that advance health equity. And then the last but really central piece of what we do is deep partnership with coalitions, advocates, storytellers, basically all of you, to bring those strategies to life and to ensure that they shape public discourse. So we use these health justice forums, which happen every other month as one space for connecting with you, but we're always eager to chat. So we'll give you ways of getting in touch with us at the end of the session. But to lead us into what we're going to do today, we're going to spend our time today exploring a few central questions. The first is digging into what we're learning at Frameworks and on the health justice team about how Americans think about government's role in health. We're then going to look at what opportunities and challenges that landscape of mindsets creates for communicators and advocates and storytellers. And finally, what strategies we can use to advocate for democratic and responsive government institutions that advance the system and policy changes we know are necessary to secure health justice. So, kind of three central questions here, and we are, as Corinne said, going to pause for questions twice. So store up those questions, put them in the Q&A. Okay, so communicating effectively starts by understanding the mindsets that Americans bring to questions of government and health. And at Frameworks, we think of mindsets as the unconscious assumptions and patterns of reasoning that form our default way of understanding an issue. These mindsets are shaped through our experiences and culture, the media we consume, the stories we hear, the way our institutions are structured. And over time, those patterns of thinking come to feel to us like common sense. So we're all surrounded at all times by a lot of stories about both health and government, and we see the impact of those stories in the way people make sense of these issues. On any given issue, we'll find that some mindsets are unproductive, which means they obscure why change might be necessary or beneficial, and other mindsets are productive. In other words, they help people see the kinds of solutions we seek as sensible, practical, or even obvious. And it's important to know that we all hold multiple mindsets, and in many cases, even contradictory mindsets. And that's important because it means we all have access to mindsets that can drive positive systemic change. And we all have access to the mindsets that impede it. And the question we're always asking at Frameworks is which mindset is activated by the way we choose to talk about an issue? So, what our research is showing is that when people think about government and health, they aren't starting from a blank slate. They're drawing on these existing cultural models, and it's important that we understand these to know how to shape our communications. So, I'm going to walk quite quickly through some of the things that we're hearing, and then Nico will dive a little deeper into some particular mindsets. Okay, we know that Americans come to conversations about health with a few ingrained mindsets that constrain their ability to see systemic solutions or the whole picture of health interventions. You'll probably be familiar with some of these. When we talk to people about health, they often jump immediately to questions of health care. So they conflate bigger conversations about health with healthcare specifically. We also know that Americans think very individualistically about health. Within this way of thinking, they imagine health is something you personally achieve through a set of individual, maybe moral choices. We are increasingly seeing naturalism mindsets driving discourse around health. So, this is the idea that our bodies inherently know what to do, and any outside interventions, think vaccines, but also other things, risk corrupting the purity of the body. And finally, we often see people explaining away inequities in health as questions of class and explicitly dismissing explanations of inequity that center on race. These are some of the challenging things that we're facing. But the good news is that Americans also hold productive mindsets about health that we can activate and cultivate as we communicate about these issues. I mentioned earlier that health individualism is a very strong mindset. But increasingly in our research, we're also hearing this idea of constrained individualism. So, in other words, an acknowledgement that the decisions we're able to make about our own health are constrained by the systems around us. It often looks something like this: it's hard to be healthy when you can't afford good food. We're also increasingly seeing broader definitions of health that include mind and body, right? A sense that mental health is part of health, and a recognition of what folks in public health might call the social determinants of health, the idea that what surrounds you shapes you, that place matters in the creation of health, right? So these may not be the most dominant mindsets, but they're definitely present for people. They can understand and access these more systemic ways of thinking about what it is that's shaping our health. Okay, so let's look at government. What are we hearing in the qualitative research about the mindsets people use to make sense of questions around government? First, we hear this really strong sense from folks that government is slow, it's bureaucratic, incompetent, maybe even corrupt. And connected to this is a sense that people therefore want a pretty limited role for government. This idea that government should not tell me what to do with my own body. People tend to think of government interventions as zero sum. So the idea that whatever benefit we might give to one group, say expanding Medicaid or other things, necessarily is going to take away from somebody else. So we're all in this kind of competitive zero sum game. And there's a strong sense, actually, both in health and in government, that the system is rigged, that our government institutions are designed to serve the wealthy or corporations, that perhaps they've been captured by industry, and that all of that is happening at the expense of our health and well being. But good news, there are productive mindsets at work too in the way folks talk and think about government. So people do see a clear role for government as a regulator and a protector. Government institutions are seen as essential to regulating industry and protecting communities from harm. People also see the government as responsible, and in some cases, as the only institution that's wide reaching enough to take responsibility for ensuring everyone has what they need. Related to the idea we talked about earlier of constrained individualism, people see the government as an enabler of that. The government plays an important role in opening up opportunities for people to make choices that will advance their own health and well being. And consistently, we see that trust in government and in other institutions, but particularly in government, is much higher at the local level. So people believe that their local government institutions are much more grounded in community conditions, much more responsive to them, and that the folks working in these systems really understand what their community needs. Okay, I'm going to hand things over to Nico to dig a little more deeply into this research and give us some practical guidance.
Cool. Thank you, Katy. It's great to be with everyone here today. So building on all that Katy just shared about how the public thinks about government and health, we just learned that people don't have one fixed opinion about government and health, right? We all hold multiple mindsets and ways of thinking at the same time. And sometimes, as we can see in those last slides, those ways of thinking are in tension. And so our job as framers, as communicators, as activists and advocates isn't to replace one mindset with another. It's to activate the productive way of thinking that already exists and that is sitting along that more skeptical or less helpful way of thinking. And when we looked across the research we've done recently, we saw that these competing ways of thinking consistently clustered around two core tensions that we thought we'd spend some time talking about and thinking about today. Because both of these tensions get to two fundamental questions that we all have to answer in our framing and in our communications. And the first one you can see on the slide here is quite simply, can government be trusted? This is an open, contested question in the thinking of the public. We see that people generally want government to help them, but at the same time, they worry that government can't be trusted. So we're going to dig into that in a second here and think about what we can do about that, how we can answer that question for folks. But I just want to share the second tension with you that we're also going to dig into over the next 45 minutes. And that's what is government's role in creating health, which reflects how people, when it comes to health concerns, generally actually want, government to protect them, but they worry that government will also try to control them, right? So we want to dig in and think about how we can activate the left side of the screen right now, right? The thinking that is conducive to government being positioned to help create conditions for health, and how we can avoid triggering some of the mindsets and concerns that stand in the way of government being part of the solution. Um, so I'm going to first dive into that first question around trust. Can government be trusted? On the side of the spectrum, on the left, we see what Katy mentioned, right? These opportunity mindsets that people generally think government should help them. People see value in government as a provider, right? As being responsible for whether people have the resources and supports that they need to make healthy choices. We also see deeply held beliefs in democratic ideals, like our government should be for the people, and represent their interests and act on the people's behalf. And on the other side of the tension, the worrying that government can't be trusted, we see a set of mindsets that contributes to people's concerns there, right? We see that people think of government as inept or corrupt, as Katy said, and people at times question the motivations and agenda of government, especially the federal government, we found. And we also see system is rigged thinking, which Katy mentioned, and we're going to dig in quite a bit on system is rigged thinking because it's really pervasive in health and it's really pervasive across issue areas that we study. And it's the idea that the system is being rigged by a powerful few at the expense of many. And we're going to dive more on that in a sec, but I just want to pause here and hear from all of you. When we look at the left side of the spectrum and these patterns in thinking, are there instances in your work that you see people wanting the government to help them? And we're going to do a little word cloud activity here. So in the chat, there should be a link to go to a place to respond to this question of where do you see people wanting government to help, right? Think about your own work, think about your existence in society and in culture, and where do you see that showing up? There's also a QR code here if you'd like to fill it out on your phone. And I'll give people a minute or two to type in their responses to that question. And then we'll share the word cloud. All right, we got some interest. Wow, we have a lot of responses here. Healthcare coming up, right? People want help with healthcare. We see affordability, food safety, clean water, medical debt, right? A lot of the conditions and systemic uh, determinants of health, economy, safety. People are looking to government to help with childcare, with access to food, food safety, infrastructure. Wow, you all are really covering a lot of ground here. And that's hopeful, right? That people are looking to government for support around all these issues, right? There's a clear need and belief that government plays a role in providing and helping around this stuff. Whether it does so or not is another question. So we're gonna thank you for sharing that. It's interesting to see, it's hopeful to see. And now we're gonna dive into how we help people frame and communicate so that they can, in theory, advocate for that kind of support from government. So I want to dig in a little bit more on the system is rigged thinking. This is, the other end of the spectrum, one of the mindsets that maybe contributes to why people may not trust government when it comes to health. So what exactly is a system is rigged mindset? It's this core mindset that has a clear structure, that there are people in power who are rigging the system at the expense of regular people who get a raw deal. And I'm sure we can all identify with that. There are real and justified reasons to feel that way in our society and in our culture. And this is a really dominant mindset that we see in public thinking right now. For instance, in our culture change survey, which we are repeatedly fielding and asking Americans, do you think the system is rigged? In America, 71% of people say yes. And this view isn't limited to specific groups in society. It's shared across groups, across racial groups. At least 65% of every group here said yes to this question. It's consistent across income levels. A substantial majority of people at every income level say, yes, the system's rigged. And a majority of people at every age level say yes. So while there's some difference in endorsement of this mindset, it is dominant across demographic groups and across ideology. And part of the reason why this way of thinking is so dominant is because it's so adaptable when it comes to who is doing the rigging and who's benefiting and who is getting the raw deal. Some point to corporations as doing the rigging, some point to government, others point to wealthy elites, and sometimes it's a combination of all three. And we see this dynamic playing out in the health domain with the MAHA movement, frequently arguing that Americans are being made sick because government agencies have been captured by pharmaceutical companies and other corporate interests. Now, whether or not people agree with that specific claim, it activates a familiar way of thinking, right? That powerful actors have tilted the system against ordinary people. And importantly for our cause here today, it positions government as the villain, not as the solution. So what can we do about this? How can we take advantage of that pattern in thinking, but position government differently? And that's the opportunity for communicators, right? That this story that we tell about the system being rigged doesn't have to end in cynicism about government. It can also tell a different story, one in which our public institutions, which ideally represent us, can help rebalance systems that have stopped working fairly. And that's our first reframing strategy today. In our communications and stories, we have to try to position government as an institution that can rebalance systems and be part of the solution. And notice in the wording here that we're not pretending that government always does this, right? Or that our current government is able to do this effectively. But we're pointing toward an aspirational role that government can play and has played in the past when it is truly accountable to the people that it serves. So part of the reason this reframe works is because it taps into productive ways of thinking that already exist. Have seen across our research that people generally are skeptical of corporate influence in health, and they worry that powerful industries put profits ahead of people's well-being. And our job is to, put government in a position to be protecting the public from those interests and holding those interests accountable, right? People believe government can play that role. They see that role for government. So here's the story, the beats of the story that you want to be organizing your communications around to tell this story. You want to start with a system, talk about how it's rigged, show who benefits from the current rigging of the system, show who gets left behind, and then introduce government, not as the hero, but as one of the few institutions that, when it's working in its best way, can be capable of restoring balance to that unfair system. Now, here's how you turn that story into framing choices in your communications. This is some sample language using the example of Medicaid, which many of you in the registration mentioned wanting to dig in on. This is pulled from some work we did with the Berkeley Media Studies group, which should be in the chat on making the case for Medicaid. It's a helpful resource. But the idea here is to start with the system. Don't start with Medicaid. Our health insurance system is rigged to protect insurance industry profits at the expense of people's health and well-being. It starts with the system, talks about the rigging, names who benefits, right? Insurance industry. Then it explains who gets left out, right? People who are priced out or locked out of private health insurance. And then it shows how government helps rebalance it through a solution like Medicaid, right? And notice that Medicaid isn't introduced at the top. We're building to that. We're leading with the system, building the case for why Medicaid and government rebalancing made sense. And this really taps into that system is rigged thinking, but doesn't villainize or breed cynicism about government. And this can work for making the case for lots of programs that are under attack, like Medicaid or SNAP. So with that, I think we'll get to our first Q&A here and see if we have some questions from you all about those mindsets or about that framing approach.
Yes, lots of great questions. Let's start with a question that is related to what you just touched on, Nico. I think you can maybe expand a little bit more. The question is, you describe the mindset about government as skeptical and less helpful versus productive, but isn't it accurate that government has been captured, e.g., continued fossil fuel production despite the progression of climate change? So you touched on that a little bit with the system is rigged stuff. At what point is a mindset or impression of the government an accurate understanding versus stories?
Yeah, I think that's an important distinction between, the way that people think about and conceptualize government right now as, potentially being captured by lobbyists and corporate interests, and the story we want to be telling about government that, plays up government's, belief, ideals and the ways that it should work and the aspirational nature of it, right? So we don't want to be denying what people feel is a reality. We want to acknowledge that and identify with it even, but we also want to not leave people there and talk about how this aspirational vision of government is something that we can achieve together. Katy, any thoughts on that?
Yeah, I think this is a really important question. We see system as rigged thinking across all kinds of different issues. And I think in many cases, people think the system is rigged because the system is rigged. Like some people are profiting off a system in which others are suffering. So the question here is not trying to tell folks that this is not true. It's about how to harness that way of thinking towards the kinds of productive solutions we know are going to advance justice and equity. We were getting some really good questions in the Q&A about, places where folks have seen women blamed for the rigging of the system or immigrants blamed for the rigging of the system. And we see the same thing in our research. Nico said this earlier, but system is rigged framing or narratives are very, very flexible, and people fill the blanks on who is rigging and in what way and to what end in all kinds of incredibly unproductive, racist, homophobic, xenophobic ways. And I think there's a lot more research that we need here. It's a really thorny topic, but what our early research is pointing to is that we need to be able to, people already believe the system is rigged, and we need to be able to give them a story of the ways in which it is rigged where they're not able to fill in all of these blanks in ways that we really don't want them to. And, this Medicaid example it is one example of a system is rigged story that doesn't cue fatalism or individualism, but that galvanizes people around the kinds of solution sets that we can come to together. But I think these are all just really, really important and thoughtful questions. I really appreciate folks offering them up.
Thanks, Nico and Katy. And there are a couple related questions to you were kind of getting in this, but like, what is the system? What do we mean when we say the system? So one person asked, we say change the system and stop blaming the people, but then the system is considered the government when we are only one part of the system. Who all is involved in the systems, and how do we let folks understand that they are the system? And then there's another related question that's, if the public has a fundamental misunderstanding of the system, for example, that public health funds healthcare or is somehow directly responsible for healthcare, how important is it to correct their understanding of what the system actually is?
Yeah, it's a great question. And I think it points to what we find time and time again in our research, which is that people generally don't understand what systems are, right? And where those lines are between health and healthcare and things of that nature. So a big role that we have is to illuminate systemic solutions, what system we're referring to, right? That's part of what Katy was talking about, and the system is rigged. Framing is how we fill in the blank on what system we're even talking about, and to illuminate these big kind of abstract things like the system for folks through specific examples is a really good way to do that. We'll get to this in a sec. Talking about how those systems show up in people's everyday lives before you bring the system into view, and reminding people that systems consist of people as well. And making sure that they understand that folks who are part of systems are people they may be engaging with in their communities every day.
One last quick question before we resume the presentation that, again, is related to what you just said about the rigged system framing. Does the rigging of the system messaging need to be paired with action? Like you can vote, you can talk to your senator, some kind of solution?
Yeah, a call to action is always a good idea in a communication. But I think the argument and the way to use the system as rigged framing is I would think more about making sure to include a solution, right? And have that be connected to an action perhaps. But sometimes, a lot of times, we see folks just using the system as rigged framing and not including a solution, right? Or the solution involves tearing down government or something like that. So we want to have it have some action orientation in that there is a conceivable solution that will address one part of how this system is rigged, right? And make that connection clearly for folks. Because it can be hard when we raise a big issue like the system being rigged and then present a small action or a small solution, right? Like calling your senator that might not feel like it gets to the unrigging of the system. So we want to make sure that those things are commensurate, the solution and the scale of this, the problem.
All right, thanks, Nico. I will hand it back to you to go ahead and continue with the presentation, and then we'll have another Q&A towards the end.
Awesome. These questions have been great. I'm so happy to hear people thinking about this and bringing these distinctions that are tricky into the conversation today. So we're going to dive into the second tension now. And just like before, just want to remind folks, people don't have a single view of government's role in health. They draw on multiple ways of thinking. So on the one hand, on the left here, we see that people clearly want government to protect them. In our research, qualitative research, we've heard productive mindsets like the government as protector, government as provider, government as responsible. People recognize that there are some things, some health conditions, like ensuring safe food, clean water, or protecting people from harmful products, that government has an important role to play in. We saw that in the examples you all shared in the word cloud. But those productive ways of thinking sit alongside those different mindsets, right on the right side of the spectrum. People worry about government as a mandator, right? As going to control you from afar, the big brother idea and conceptualization of government, tyrannical government, ideas about limited government and not government not infringing on choice and agency. These ways of thinking raise concerns about government overreach and losing personal choice. So once again, we're not looking at two different groups of people here either. We're looking at two ways of thinking about government that many of us hold simultaneously. And it's a challenge, but it's also an opportunity. So rather than beginning with government itself in our communications, how can we begin with something people already value and experience, right? The everyday protections that help communities stay healthy. And then we can reveal the work that government does behind the scenes to make those protections possible and bring them into the conversation. So we want to hear from you again. We're going to do another word cloud. This time, we're going to look at the right side of the spectrum and think about what are the issues that you all work on or that you all see in your work that, where people might be concerned about government overreach. So take a second here to scan the QR code, and Katie's going to talk us through what she sees here.
Awesome. I think folks are entering their answers. I'm eager to hear what you all are thinking about. All right. I expected to see vaccines at the middle of this chart, and that is in fact what is happening. I think that's a key example that folks are coming to us with as they're thinking about this. But I'm also seeing reproductive health as a women's health as a mask mandates, right? Things from COVID, other kinds of mandates. Yeah, this is really interesting. And substance use. Yeah, so I think there are lots of examples, and many of them really in the news right now of places where folks are pushing back, where they're talking a lot about government overreach and a nanny state. And we hear a lot from folks that they want strategies to contend with that, right? To respond. Okay, so let's talk about just one of those strategies, and then I'll hand to Nico for another. Several of you had said both in the chat and also in the Q&A that our systems actually are rigged and serve people unequally, and that is, of course, true and has been true for a long time. And so, one important part of having these conversations about government and health is to take seriously the ways in which government institutions have harmed communities, and to both acknowledge that harm and its long-term consequences. When we gloss over this or ignore it altogether in our communication, we're only giving fuel to the idea that government makes people's lives worse, and that fears about government overreach should hold back our ability to put in place programs and policies that protect and build community health. So acknowledging past harms, at least in some forms of our communication, is an important part of contending with these arguments around government overreach and government ineffectiveness. So just like Nico did earlier, we're going to walk through the beats of a story that you can tell. So our research has shown that this structure is a really effective way to acknowledge past harms and it furthers people's understanding of health equity. So we were getting some questions earlier about what it is we're measuring when we're recommending a reframing strategy. These beats increase people's understanding of health equity. They also decrease things like fatalism and individualism, things that we know hold back progress on systemic work in health. So when we tell stories that describe past harms, so we have to describe and acknowledge the past harm, tie those harms to current inequities by explaining, not just telling, but explaining how one leads to the other, and pointing people toward the collective action we can take together, or even the collective action we currently are taking together to address the inequity. We build people's understanding of health equity. We help them build mental models about the intersection of race and other forms of inequity, of health and other forms of inequity like race. And we build trust by acknowledging the ways in which government has created harm in the past and pointing towards the kind of democratic, responsive, transparent government systems that we're trying to build to ensure that we're protecting community health going forward. So I'll just give you a quick example of this. You could tell all kinds of stories that acknowledge past harm. This one is about neighborhood designs. We first point to the past harm, right? We're explicitly pointing out the system here. So these health patterns like high asthma rates, they're not random. They come from policy choices that we have made in the past. We're explaining why that is true, right? I find often in people's communications, they drop words like redlining that I can guarantee you many people could not effectively define. So we're talking here about redlining practices that devalued Black neighborhoods, the ways that we have designed our neighborhoods that put certain people at a disadvantage, and directly connecting that to the impact on health so people can draw that whole story right from policy choices all the way to health outcomes. And we're being explicit about the ways that systemic racism explains the health disparities we see today. I do want to note that some of you are going to be in positions where this sentence, the history of systemic racism, helps to explain the health disparities we see today, may not be a sentence you can include in your communication. But the advantage of this model of explaining current inequities rather than just name dropping them is that you have an opportunity to explain this in language that you can use even without using these words. And then really importantly, we talked about this in system as reframing. We're also talking about it here. We need to offer people a collective path forward, right? So there's been harm done. We can explain the long legacy of that harm, but then we need to offer people a collective path forward. So together we have an opportunity to address these inequities by investing in these neighborhoods and advancing policies that ensure cleaner air for everyone. All right, and I'm going to hand it back to Nico.
All right, thanks, Katy. Okay, so the last reframing strategy we have here is to talk about government as a local enabler of the conditions that keep communities healthy. Real big emphasis on the local part here. And this is because our research shows us that there's a way to talk about government playing a positive role in people's lives and in their health when we do so at the local level. When folks see government as a local protector and not a distant controller, they're more comfortable with that role for government. And we see this in the qual research we do and the quantitative research we do, that people generally view state and local government as more responsive, more representative, and closer to people's actual lives, which won't be surprising to many of you. But one thing that was surprising to us was this quantitative research we did back in the fall. And it's one of the biggest opportunities we found in health justice, and maybe some of you have seen it already. And what we did was we asked people, have you heard anything about your local public health department and what it does? And you can see that only a third of people said, yes, I'm familiar with it or aware of it and know what it does. And then we asked just that group about their trust in that same institution. And the data suggests that we may have overestimated the problem of distrust in governmental public health, at least at the local level, right? We see that strong distrust is a tiny minority here, 1 to 2%. And that's just of people who are familiar with the institution. And those trust numbers are pretty similar to trust levels we see for people and their physicians, right? People trusting their physicians. And it points to the reality that people trust health resources that are proximate to them and that they are in relationship with, right? Trust is relational, and we know that. So when we think about government and how it earns trust, it's by being seen and felt as an enabler of the conditions that help people make healthy choices, right? And that help communities be healthy at the local level. So, what's the story we can tell here to build awareness of government in public health as an enabler of health? And it's what I mentioned earlier, starting from the ground up. Oftentimes we're talking about big programs like Medicaid, and we lead with talking about that. How can we start at the ground with something that people value in their everyday lives or something they experience in their everyday lives? And then revealing the system behind that, right? Explaining that to people and ending it by showing not only how it benefits them as an individual, but how does it benefit the entire community? How do we benefit collectively from this work that's happening? And here's an example. I have the pleasure of working with a lot of local health departments, and a big role that they play is ensuring clean drinking water. So notice how this starts. I'm not going to read it, but it's written from the perspective of a local health department, and it doesn't begin with the local health department, right? That comes in the second sentence here. It begins with something that everyday people, our audiences, folks in community care about: safe drinking water. And it starts with the value of strong communities. So only once that value is activated and we're talking about an everyday experience that people are familiar with, then we talk about the public health work happening, right? And we're making that visible. There's the adage that public health is invisible work. We need to be in the business of making it more visible for folks. And then ending with the collective benefits, right? Harkening back to that value at the beginning. Now, some of you don't work at local health departments, I'm sure, and I think this principle travels beyond local public health, right? So people do understand government's role best when they've seen it operating in a familiar local context, but we can zoom out from that and bring into view interlapping systems of government, like state and federal public health systems. So the place that you do that in this story outline is in the middle, right? We want to zoom out in the middle. So starting with the familiar everyday experience, here's an example that pulls on what we saw in the word cloud: vaccine access as being an area where maybe people feel that government may overreach. And it follows the exact same structure, right? It starts with something people value. Communities thrive when children have the opportunity to grow, learn, and simply be kids. It then reveals the local partnerships between folks outside of health, like schools, that are working together to make routine immunizations easy and accessible for families, right? Many people have that experience. And then it zooms out to show the larger public health infrastructure and systems that make those experiences possible. And then it ends with the collective benefits, right? It ends on that optimistic note. This never makes the audience leap from Washington to their daily lives. We're moving in the opposite direction, and we're helping folks notice government that they already experience and connect it to the systems that create health. So those are the three framing recs we have. But before we open the floor to more questions and discussion, which I'm sure there's a lot of, and curious to learn from your work and your perspective on this as well, I'll just touch back on what we heard at the beginning. People already have productive ways of thinking about government and health. Our job isn't to convince them that government belongs in health. It's to strengthen the ways that already exist, that people have access to help people see government a little bit differently. So on the left, we have some strategies, quick tips to focus on, and on the right, some things to be a little more wary of in our communications, because we know these kind of quick tips can be helpful for folks. So across both the tensions and all the framing recs we shared today, we see the importance of leading with shared values and community idea, concept of community well-being, instead of perhaps leading with the program or agency or the initiative, right? And we see an example here, our department's drinking water program. We're moving fast and we're doing our work, and sometimes that is the first thing that comes out. But how can we go a folder up and let people know why this might matter to them first by using a value? The second thing to focus on is depicting public health as practical, local, and ongoing. People, if we are exclusively telling stories of government public health in moments of crisis, then and when something goes wrong, then people will think of public health as this episodic actor, right? Not something that's in their lives all the time, ensuring the conditions for health. And as I said earlier, we want to provide concrete examples of government actually doing that work of creating or restoring fair conditions in systems or in communities, right? And examples are a framing superpower. They really help illuminate what we're talking about when we're talking about systems which are abstract and hard to understand. So you would do that instead of maybe leading with government authority, mandates, or enforcement, which might trigger some of those less helpful mindsets, right? So talking about leading with new regulations require X, Y, Z could trigger those ways of thinking. And lastly, we always want to be focusing on systems, conditions, and everyday experiences, connecting and bridging between those things, systems and everyday experiences, instead of relying on technical language or excessive data or long lists or institutional processes. And you see an example here. Phase 2 of our strategic plan includes whatever. How do we talk about how people actually experience systems and health and government in their daily lives? And with that, we'll open the floor to some more questions, Corinne.
All right, let's see how many of these we can get through. Really appreciate all of you putting really, really great and thoughtful questions in the chat. There were several questions, which Katy, you addressed this a bit when you were talking about past harms. And I think it might be helpful to talk about current harms. So in the chat, let me just read a couple of the questions. So one person said, but the system is rigged is what's actually happening in DC now. How can framing dispel a mindset that is reinforced every day? It feels like we need to acknowledge the rigging that's happening now. And another person said, government is currently being used to target people, citizenship status, protesting against government actions. Depending on where you live, your local government is protecting you and your neighbors, or it is making you and your neighbors vulnerable to harassment, imprisonment, and other challenges. Is this a good time to be trying to build trust in government? So maybe talking about some of the current harms would be helpful to folks.
Yeah, I really appreciate these questions. And of course, all the things that folks have pointed out here are really true. And I think what Nico and I are talking about and what this research is pointing to is not defending current systems of oppression or asking people to trust systems they know are harming them right now, but trying to help build a narrative of the kinds of government systems we want that would serve people equitably. I think one of the huge challenges which we experience even as we're doing this research internally, right, is that we see the ways in which government has harmed communities, and we also see the ways and the ways in which it's inadequately infrastructured to meet the needs of communities or to always deliver on its mandates. And we see the ways in which government is actually a necessary component of achieving the kind of health justice that we want to see, that it's not possible without the scale that government brings. So this is a very complicated topic, and I think what we're pointing to here is narrative and framing strategies that galvanize people around a vision of the government systems we want for our communities, not asking them to trust the systems we have now, especially as they're actively harming folks. I just also want to say in response, there's been such good questions and such interesting conversation today. And part of the commitment of doing these framing forums is to share research with you as we're learning it in real time. And that means sometimes folks have asked questions today that I think are really important questions that we should find answers to, and we don't know the answer to every question right now. We're preparing new research in these areas, and are excited to kind of continue sharing with you as we're learning, and really appreciate you all being part of shaping the questions that really need to be answered.
Thanks, Katy. Another set of questions around the idea of helping me versus helping all of us versus helping some of us. This came up when you were talking, some of these questions came up when you were talking about collective benefits. So a couple of these questions, I'm just reflecting on how the want government to protect me, not control me tension shows up for me as I want government to control others, but not myself. Would welcome thoughts on how to reframe this. Someone else asked, what about the framing that government is meant to support health of only some people, like deserving or wealthy people. So wondering if one of you can speak to that.
Go for it, Nico.
I was just on that first piece. I think, it's tricky because people think so individualistically. Oftentimes, when we're having conversations like this, people are like, oh, how do we tap into that individualism? If it's so dominant, how can we, really use that to our advantage? And we always remind people that even though it might help in the short term, to get something to resonate with somebody, we also are doing ourselves a disservice by not also beefing up people's understanding of, how things benefit the collective, right? And I think it's hard, especially when we're talking about specific health issues and issues within health, to try to make it about the collective as often as possible. And I think, implied in Katie's recommendation around acknowledging past harms, talking about how the benefits don't always reach everyone in our society and that people are left out is an important step in that. And I think we should always be trying to both acknowledge that, but talk about how we can extend the benefits of whatever we're trying to advocate for to everyone who in society, really. I'm not sure if that got to the essence of the question, but um, Katie, do you have anything on that?
No, I think that was a great answer, Nico.
All right, thanks, Nico. Another question is around how we can focus on systems, conditions, and everyday experiences when we're sharing things like community health improvement plans. Is there a place for talking about plans? What does focusing on systems, conditions, and everyday experiences look like? So I think this is a question about plans, but also there have been other questions that are related about when we're talking about something that might feel really specific. How do we make make this system visible, and how do we relate it to those everyday experiences that feel relatable to people's lives?
I agree with you, Lori. This is a great question. Community health improvement plans are actually a great opportunity to communicate about the value of public health interventions and systemic interventions. Obviously, you're going to have lots of things in your plan that are not making the case for equitable public health systems. And that's totally appropriate. But I think there are lots of opportunities in the framing of a community health improvement plan or a similar kind of plan for giving folks a sense of the vision of where you're trying to go, right? What we were talking about earlier around being forward looking, and also making the case for interventions across the population at the community level that are not individualistic, that are systemic, that are looking upstream. I often hear from folks, particularly in governmental public health. There's been a lot of conversation, particularly in the last couple of years, about how difficult it is to make the case for governmental public health. People don't know what it is. They don't know what we do. They don't understand why it is important. And when I've asked folks, what are the circumstances in which you get asked or you find yourself explaining the value of public health, folks will often say, I never do that. Like I answer a question about vaccines when I get asked a question about vaccines. I answer a question about a disease outbreak when I get asked a question about a disease outbreak. I think part of what we need to be doing as a field is looking for the opportunities to tell even a small story about the value of strong, equitable public health systems, even in more specific questions, right? So when we talk about vaccines, we have an opportunity to say, we recommend vaccinations because this is a way we keep all kids healthy in this community, right? When you're talking about, water stuff in your community, you can say, this is an essential function of public health. It's something we do for all people in this community. There are just these really small opportunities to reinforce this message. The community health improvement plan is actually a much bigger one with probably a lot more page space to be doing it, but I think it matters that we look for those opportunities and we take them when we have them.
Yeah, and I just had one other example of connecting everyday experience to big systems changes. that would maybe be mentioned in a plan like that or other plans. And it's to try to like think, okay, we're working on this upstream thing like train workforce training for folks in a specific sector like maternal health, for instance. Um, Trying to make the connection for audiences of what does that look like downstream? What changes in a birthing person's life or their experience because of that enhanced workforce training program that a state might be implementing? And trying to just, even in your plan, spell that out for folks can go a long way for connecting these big systemic conditions to everyday experience that folks would have.
Mhm.
Last question for you both, maybe in just a couple of words, you could both answer. This is a time in which the system is rigged thinking feels really valid. Things are hard. There's a lot of misinformation about public health. What is one thing that's making you feel hopeful?
Nico, you should take this. You've been having a lot of hopeful conversations lately, I feel like.
I would love to think about it more, but I think I'm really hopeful about how people, at least in my experience, see that trust slide, and it feels like it gives people a sense of folks within public health a sense of agency and power in their storytelling. People see that slide and they're like, oh, I need to be telling more stories about my public health work and making my public health work more understandable to people because people generally trust their local health department. So I'll speak on that part. I've seen people's eyes light up at that and get excited about the idea that validates their experience that people value local public health. What do you got, Katy?
I think that's such a good answer, Nico. And I just also want to say that, even when things feel quite challenging at the national level and in some communities, there are examples of local and state health departments and community organizations and hospital systems all across the country doing really important, innovative, equity focused, like justice oriented work, right? Really partnering deeply across sectors, really building power in communities, really centering voices we don't often hear from. That's all happening even as the dark stuff is happening. And I think it's really important to look for that and to tell those stories, right? They're easy to lose in the context of the national media conversation. Um, Thank you, Corinne, for this question. This was a really lovely way to end. I really appreciate it. I also really appreciate how robust the conversation has been today. My favorite part of my job is tackling hard questions with really smart people, and I feel like we did that with about 500 smart people today. So just really appreciate it. Um, in terms of next steps, I think you've had a poll on the screen for a little bit. We love when you give us feedback on these sessions. It really does inform what we do next and how we shape our research. Our next framing forum is on September 16th at 1 p.m. We're going to be tackling the question of stigma and how we communicate around stigma. As I mentioned, we have a monthly newsletter that came out last week. If you're not subscribed, you're missing a lot of good stuff. So please sign up for the monthly newsletter. Walker just put the link in the chat. And then we hope you follow us, and we really do hope you reach out. I know a lot of you had really important, big questions. We're here to try and help you answer those. So please be in touch as you move your own work forward. Oh, and Corinne has noted we're also hiring. So if you're in the job market, please take a look at that job posting, working directly on health justice and also on our children, youth, and families work. But thank you all so much for being here. Really appreciate it.